Hi, welcome everyone. It's nice to be here. Welcome to the Partnership at Drug Free New Hampshire's National Prevention Week Facebook Live series. We've invited prevention specialists from a variety of roles across the state of New Hampshire each day this week to share their story, their prevention story, their expertise, their experience, strengthening community, building resilience, and creating hope. And I'm really happy to have Marissa Carlson here today with us, the Executive Director of the New Hampshire Teen Institute. And she is also the President of the New Hampshire Prevention Certification Board, and which is a perfect fit for today's National Prevention Week topic, the talent pipeline, enhancing the prevention workforce, which is the goal of the New Hampshire Certification Board. So I'd love if anyone is listening today to just maybe pipe in your name or where you're coming from, where you're listening from, and please do ask any questions through the comments and we'll be able to address them as we go. But welcome, Marissa.
Hi, Julie. Thanks so much for having me. I'm excited to be part of this great programming that you've put together for this week.
Thanks. It's been a lot of fun. So, often when people ask me what I do and I say, oh, I work in prevention, I get a lot of sort of tilted heads and a little, quizzical looks, and they don't really know what that means, understandably. So I'm hoping that you can share with us, what is working in prevention and what is a prevention professional? Where do we see them and what are they doing?
Yeah, absolutely. It's a great question. I have definitely gotten some of those head tilts as well. So I love demystifying that. So folks who are working prevention, prevention really comes out of the substance use disorder prevention world, right? So thinking about different aspects of behavioral health, when we think about what do we want to prevent, we want to prevent some of those negative outcomes from happening to our community members. So while it has its roots in substance use disorder prevention, it's also great. We're working on a lot of things that community members might also have impacting their lives. So there's definitely a crossover with mental health, like negative outcomes in mental health prevention, violence prevention, bullying preventions, a lot of school climate things. So we might see prevention professionals working in a lot of different places, certainly in schools, right? So we have our SAPs. So those are substance abuse professionals. Those might be working in schools. They might be working with the guidance counselors, but they have a little bit of a separate direction that they take things in. We have folks working at the community coalition level. So there might be a coalition in your community or maybe for a group of towns in your community that looks at substance use disorders, healthy families, healthy communities, is doing a lot of work that way. So there might be maybe a certified prevention specialist there or some other prevention professional who's kind of along that route. We might see folks in community organizations. So for us at the New Hampshire Teen Institute, we have a number of prevention professionals that work with us because so much of the youth and adult programming we do has a prevention component to our work. We might see folks at the bigger kind of state level or maybe a regional New England level. So we've got folks who are prevention professionals who might be working with the Department of Health and Human Services, or maybe at your regional or county health department, maybe something at the New England level within the federal system. So you've got prevention professionals there looking at how do all of the different things that support health and wellness in our communities interact? How do they kind of interlock and support each other across larger regions? So you've really got the folks who are on the ground working with our community members, maybe teaching a class around life skills, teaching a class around how to say no, to substances, working on how do we feel more empowered, how do we feel like we have the self-esteem and self-efficacy to like make great choices for ourselves. But then you've also got people really taking that 30,000 foot look too at what are some of the policies and procedures that really make up healthy communities at that larger level too. So you've got certified prevention specialists all over the place. You've got folks who maybe are on that track, and we're really finding them really working in all those different aspects of our communities.
Okay, so you just said certified prevention specialist, right? And that's what that certification board does. So what is that? Because I think, you know, all those jobs that you just listed, many of them, you know, people are doing great community work. They're working with kids. They're promoting healthy behaviors, healthy choices, you know, positive youth development. But probably not everyone is a certified prevention specialist. What does that mean? What is that certification?
Absolutely. That certification comes through an international credentialing body. So there's an overarching prevention professional certification that comes through the ICNRC is what the body is known as. And that's something that's available in almost every state in the country and a lot of other international areas as well. And it's really a multifaceted kind of credential that looks at training, so some education pieces, looks at work experience. So what have you been doing either as a volunteer or as a paid professional out in your community? And then there is a testing component that kind of pulls some of that together. So it's really trying to get at some of the different skills people would need. To be able to carry out curriculum or to look at policies, to understand advocacy within the systems they're in. And then also just to kind of know some of those best practices. So really to get into some of the prevention science. What are the kinds of things that work? For instance, we know that much like for a lot of physical ailments, we know that substance use disorders also have risk and protective factors for them. We can identify, the science tells us that there are like certain conditions, certain things that might happen that put us more or less at risk for developing a substance use disorder later on. And so a lot of the prevention credentialing process is also kind of getting that understanding, getting that knowledge so you can do the most effective prevention work within your communities, or kind of whatever piece of that puzzle you're working at, whether it's in a classroom or really whether it's at that big systems level.
Is it hard to become a certified prevention specialist?
We hope not. We hope that the barriers aren't too much. There's an aspect, as I said, there's an aspect of education. One thing I really like about this credential is that while there are kind of a baseline, there's some professional domains, some domains of knowledge that you definitely have to get training in each of them. But the minimum numbers for each of those areas is pretty low compared to the total number of hours you might need. And so you can really tailor the professional development courses that you take to your role. There's really a lot of room to customize, you know, what you're doing. So if you're someone who works with youth, for instance, you might want to take a lot of courses that apply to the credential that are about youth empowerment or about youth development or working with certain groups of youth. But if that's not your thing, you know, you might want to take more things around policy or, you know, how to advocate for the science of prevention within a local or state judicial system, legislative system, right? So depending on what your focus is, you can really kind of take the training pieces in a lot of different directions and still have them relate back to those overarching domains. Like one of the domains would be like, you know, delivering a prevention program. So, you know, you could learn about a curriculum really closely if that's kind of one of the things that you're doing and have that count towards a lot of the hours of the education you would need. There's also, you can have up to half of your work experience be volunteer experience. So if you're someone who's maybe newer to working in one of these roles professionally as your full-time job, but you've done a lot of community work, a lot of volunteerism around health and wellness, you can likely count a lot of those volunteer hours towards that work experience. So those are a couple ways in which I think we can kind of celebrate that it's a credential that is not super, super rigid. And really takes in a lot of people's life experience and different forms of education, and really values how that applies to prevention work and to that kind of idea of community health and wellness.
Great, thank you. You know, and that makes me think of this week we've been talking, you know, with everyone we've talked about, we've really thought about the theme of the week, which is, you know, strengthening community, building resilience, and creating hope, right? And that we all have a role in that. So back to that idea of that there are these like very specific substance use prevention professionals, right? That have these very specific roles that's like the you know, really like direct scope of their work, whether it's direct service or like you do at TI, or if it's more a coalition. But then there are so many members of our greater community and our schools and our other organizations that are building what in the field we call protective factors, right? Strengthening community, creating connectedness at school. Those are things that we know prevent substance misuse, right? Across the lifespan. So I guess I'm wondering, what benefit is there for perhaps, I don't know, a school teacher or a guidance counselor, who have their super specific scope, right? And they're asked to learn so much, or a paraprofessional or the director of an after-school program. What benefit, or what, I don't know, how do you see taking some specific prevention classes benefiting them?
Yeah, I mean, I think the way kind of the structure of the certification process is, I think there's a lot of opportunity for the certification to kind of fill in some areas of knowledge that you might just be adjacent to, but missing a little bit within, your current kind of professional role. So, maybe as a teacher, you are obviously super strong with some of those, a lot of those protective factors, right? Of empowering youth, inspiring inquisitiveness, inspiring goals for the future, things like that. But maybe you don't know as much about some of the brain science, right? Of like, how do substances impact the body? Why is it important, for instance, at the age that your students are? Why is prevention important? Why is reducing use of substances important, right? So maybe that's some information that can kind of just add on and enhance the work you're already doing. But maybe, on the other hand, maybe you're a public health professional, maybe having like a degree from, like within a public health field or maybe a social work field. And maybe there's a little bit more of that direct services about that delivering a curriculum that you haven't done as much, right? Because you're kind of working on that big picture level. So you get a little sampling of that, a little bit more, a more ability to be well versed in what that aspect of your community might be doing. And so it's going to kind of enhance your work in that way, but without putting a ton of other asks onto, your already busy schedule and other types of maybe recertifying or relicensing that you might have to do for another role, like if you're a medical professional or, something like that. So I think there's so much crossover. There's so many things that can fit within the requirements of the certification, but it's probably going to fill in. It's going to like fill in a little bit more of that knowledge base and really just diversify some of the skills and the knowledge around health and wellness, around substance misuse prevention, around empowering community members to take on leadership roles, right? There's some very specific sciencey skills that come with it, but there's also some really nice, like big picture, like community feel good stuff that comes along with it. Like, how do we make our community members feel like they have an active role in making the community better and healthier and stronger, right? There's so much that comes along with it. And so there's going to be something that there's probably a piece of the prevention credential that you're already doing if you're working kind of anywhere in health, human services, education, law enforcement, community government, anything like that. But there's probably some pieces you don't do. And so kind of getting a little bit more of that broadening out that knowledge is really an asset to, again, also the way we pull together different sectors for the work that we do, no matter kind of where our main focus is.
Yeah, and that makes me think about, the fact that there's so much work going towards like what we can identify as prevention, right? So the work that you're already doing out in the community, and as prevention professionals, we can say building green spaces. We know that that's part of an important community prevention, approach. And I think for me, one of the benefits of when you learn a little more about actual like prevention science, you understand how all these community pieces work together to promote wellness and prevent not just substance use, substance use disorder, but promote, healthy lifestyles, prevent diabetes, prevent chronic disease, right? Like how all these pieces of building resilience, strengthening community, and creating hope really prevents so much and promotes so much wellness. And kind of taking some of these Prevention 101, kind of classes helps connect those dots for people in the work that they're doing, I think, as well.
Can I say along with that too, is that I think it also, depending on where you're working, can give you new language that is really compelling to help connect different sectors of the community and get them excited about a project you're doing. I think because you gave such a great example, like maybe you're someone advocating, at a community level for green space, right? And it's at some point, like the argument just might have stopped at like, okay, this is good, it's healthy for people. And to kind of have some of that prevention education that gives you some of the more specific language as to what that actually helps with. There's like, why is that important for resiliency? Why is that important for healthy outcomes? Why is that important for mental health in our community? To really be able to kind of back that up with some of the research piece just makes that like argument and makes that thing you're passionate about, makes you an even more informed and passionate advocate for that. So that's another way that can really be helpful.
Thank you for that. We have a question in the chat, and then I have one more question for you. And we're trying to keep these to about 15 minutes. I haven't been successful yet, but I've kept them all under 20. Edward Batista asked in the chat, do people know how to reach certified prevention specialists? And I think that's a great question. And do you want to take it? I can take it.
That is a great question. It differs a little bit in every state. So because each state kind of has the freedom to take the basic standards that are set at the international level for the credential, and then kind of add things that might be appropriate for working at their state level. The states really have a little bit of difference and have a lot of freedom to have their own certification process. So through that, I would say if you're looking for someone, your state certification board is going to be a great resource for that. I know in New Hampshire, we tend to keep a fairly up-to-date list of who's certified within the state on our website. So obviously with the professional's permission, we would include contact information if folks are kind of either looking to reach someone directly or even just kind of want to see, oh, where are people? Like where again, almost back to the initial question you asked, Julie, like where do we find prevention professionals in our state? So looking at the list, you can kind of see that data overall, but then also, reach out to someone directly who might be listed on the state website. So that's usually a good resource. What were you going to add, Julie? Sorry.
Yeah, I would say that, and I'm hoping that one of my colleagues could put the New Hampshire Certification Board website in the chat, in the comments. I had chatted it to you. Thank you. And then I would also, so I would say reach out to the certification board, and then you can also reach out to the partnership at Drug Free New Hampshire and reach out to me to kind of think about the area, and then I could facilitate that. Also, your local public health network, your substance misuse prevention coordinator is a good contact, and you can find that information on the partnership at Drug Free New Hampshire's website as well.
And I know,
so my last
I was going to say, just for that question, the acronym in New York is OASES. It's OASES, I think, which could be a good lead for our New York neighbors. For finding what that resource might, or at least a place to start in New York for finding folks in your area. Okay, sorry to cut you off. Good.
Thank you. No, that's great. My last question is, why do you do what you do? Why are you in prevention?
Yeah. So my background is a little bit more in kind of youth artistic empowerment programming. So I have a little bit more of a history on, arts education. That was really my kind of initial background and where I saw my career going. I got involved with the New Hampshire Teen Institute as a volunteer back in 2004, really just because I had a close friend who was also a volunteer and they needed an extra person for a program. And it turned out that really stuck. There's a lot about the programs that we do at the Teen Institute around youth empowerment, and really that idea of youth can be leaders and you don't have to wait till a certain time in your life to care about good things in your school and community, like to care about health and wellness. You can really be that advocate. You can be that person taking charge at any age. And so that really resonated with me and really fit in, was a great overlap with a lot of the things that I really loved about arts education, that idea of coming together with a group of people at any age to really create something, and create something that also taught you some really great skills in the meantime. So I think that was really how I came to it. And then as I really liked what the Teen Institute did, but becoming a full-time employee and going through the certification process really helped me understand the why, and the why it worked. Why was what we were doing actually helpful in the long term? And so kind of my certification process and becoming, getting to kind of that level of prevention professionalism really helped me understand kind of the start to finish of what I do in my work and why it works. So that's I think that's kind of the short answer of why I do what I do, but it's super rewarding, which I love. And oh, Claire, I'm so excited that you are going to look into getting your CPS. That is so awesome. I love that. Great. So it has been really such a pleasure to be here, and I really wanted to thank the partnership at Drug Free New Hampshire for having me here. It's been such a pleasure. And Julie, I don't know if you had a chance to see in the chat, but Claire's excited about looking into a certification now. So that is wonderful. If there are questions we can answer at the New Hampshire Certification Board, there's also looks like you're listening in from Boston. There's definitely the Certification Board in Massachusetts as well that can help with that state-specific process.
Great, thank you. And we have in the chat, we have put in the comments the Certification Board link, as well as New Hampshire Teen Institute. So if you're curious about some of the programming that inspired Marissa so deeply to come into prevention in 2004, she said, you can check that out as well. And I did want to just say, you might be out there working in capacity, and becoming a certified prevention specialist isn't necessarily on your track, but you're just curious how prevention fits in some of the work. Like, you're curious how some of the things we were saying, that prevention is everywhere and we're all part of it. The partnership at Drug Free New Hampshire can talk and do presentations, as does the New Hampshire Teen Institute. They go into schools and organizations and communities and do workshops and trainings for adults and young people alike, to really show that connection, and what we do on a daily basis is really benefiting our communities and helping prevent substance misuse and promote mental health. So, it may not be, entering as a certified prevention specialist, but it could be just learning more how your work intersects with that of a more formalized prevention professional. So thank you for joining us. I'm sorry I disappeared for a couple of seconds, but we really hope you enjoy the rest of this day. Stay cool, and Marissa, thank you as always for joining us.
Thanks so much. It was such a pleasure.